And then this is just going to measure the length of your cervix, and your cervix looks nice and long and closed like it should. And that'll be this area from here to here, and that's normal.
Okay.
And then next we're going to take some pictures of your placenta. And this gray area here is your placenta, and that's on the back or the posterior wall of the uterus, which is fine. It's nicely attached to the uterus and not blocking the birth canal. Looks good.
Mm-hmm.
And this is just looking at the placenta from a different angle, and also nice and normal. And this is where the umbilical cord inserts into the placenta, and that's normally positioned. And then this is just going to take a look out towards your ovaries. And this is out towards the left ovary here. That looks good. I'm not seeing the right ovary, but nothing abnormal.
Okay.
And then we're going to just come back to the top of the baby's head. And we're going to measure baby's head first from one side to the other. And then the head circumference. And we'll measure the head, the abdomen, the thigh bone, and the upper arm bone, and that'll estimate the weight of the baby for us.
Oh, okay.
And then we're going to look at different parts of the baby's brain. So just like we can see inside of you, we can see inside the baby. And then little gray areas here and here are called the choroid plexus part
Ahí
of the
está su
brain.
cerebro.
Then that part of the brain makes the spinal fluid. It looks normal. And then this is the lateral ventricle. It stores the spinal fluid, and that's also normal. And then we'll go from the top of the head back towards the face. This is catching the lens of the eye, and that's normal. And then this is the lens of the other eye, also normal. And this is just zoomed in towards the tip of the nose and the lips, and that view just shows that nose and lips are formed correctly, so no cleft lip or cleft palate. Looks good.
Okay.
And then we'll follow the spine. And all the way to the lowest part of the spine, and that's normal. And then we'll also follow the spine in cross-section. And crosswise, it just looks like little white dots.
Mm.
And that's just another good way to show skin covering the entire length of the spine, so no spina bifida. And this is the back of one leg here. And this is the back of the other leg here. And then that's the penis there. This is boy. Here.
Ahí está su private.
And next we're going to measure the upper arm bone. And this is the right arm here. Okay, and that's normal. And that arm is just up and by the head. And that's catching the little bits of the fingers and the thumb there. And then the left arm. is also up by the head. And the fingers also look good. And then we're going to zoom in towards the baby's chest and look at the heart. And these are the two upper chambers, the atria, and the two lower chambers, the ventricles. So the four chambers of the baby's heart look normal, and the blood. Next we'll look at the blood vessels coming out of the top of the heart. And this is the blood vessel that comes out of the right side of the heart, normally positioned. And this is the blood vessel that comes out of the left side of the heart, also normally positioned. So the four chambers of the baby's heart look normal. The blood vessels coming out of the top of the heart are normally positioned. And we're just going to save a slow motion replay showing normal heart, normal blood vessels.
Mm-hmm. Su corazoncito, ¿cómo está?
And then we're going to put color on the heart, and color is just going to show the direction of blood flow in and out of the heart.
Oh, that looks good.
And that looks good. And then we'll measure how fast the baby's heartbeat is. Okay, and this will tell us the heart rate. And it's 158 beats per minute, and that's normal. And this black spot here is the baby's stomach organ. Lets us know the baby is swallowing, and they swallow the amniotic fluid, and that's normal. And this is going to measure the abdominal circumference. Looks round like the head of the face just because we're in cross section. Good. And that's also normal. And then this is where the umbilical cord goes into the baby's belly button. And that lets us know the abdominal wall is formed correctly and the intestines are on the inside, not the outside. And little variants of gray here. And here are the kidneys, and they're both there, and they both look normal. And then this is baby's bladder, and the bladder lets us know the kidneys are working. And then we're just going to put color on the blood vessels of the umbilical cord. And that lets us know that there's 2 arteries in a vein, a normal 3-vessel umbilical cord. And then this is the right thigh bone. And that's also normal. And the feet are just crossed at the ankle. And that's a normally positioned foot there. And then the left leg. And that foot's up in the air there, also normally positioned. And this is the little pinky finger, and there's 3 bones in that finger, and that's normal. And the hand's nicely open. And this is part of the brain called the cavum septum pellucida, and that's normal. And this is the back of the brain, the cerebellum, and that has a normal appearance, and that's a good indication the baby's spine is normal, and that looks good.